Hi, I'm Gail Ashley, and this is
Lynn Drake.
Lynn Drake. We're here to do your training video on enhanced PPE donning and doffing. We are in our training center, and we're using this to represent an exam room that you have chosen in your clinic. So just keep that in mind. All right, we're going to get started. Before Lynn goes in to get or gets her enhanced PPE on, I'm going to have my checklist here. Lynn has to be observed by an enhanced trained observer. I'm going to act in that role, and Lynn's going to be our donor. I do have my checklist that I'm going to be able to use to make sure that we hit all of the steps, and I will initial off as we go along.
For myself, being the person who's going to be getting on the enhanced PPE, it's very important for me to listen to Gail, make eye contact with her, and not to do anything putting equipment on or removing it until I'm sure she has her eyes on me.
Okay, so we're going to gather all of our necessary equipment, which we have laid out here in the clinics. You have been brought your Ebola totes, and that has all the equipment in there. We have the gown, the booties, surgical mask with face shield, a face shield, surgical hood, regular nitrile gloves, and extended cuff nitrile gloves, and well as duct tape. So before Lynn goes in, she's going to put her hair back because all hair has to be contained. And then I would have Lynn use the restroom and perform hand hygiene. So she's ready to go in. So
I also need to take off any watches, my lanyard, ID band, and if there's a ring that you cannot remove for whatever reason, it should be taped into place.
that, especially if it's a stone ring, that way it will not puncture your gloves, which is really important. Okay, Lynn, I'm going to have you put on your disposable boots.
Be careful when you put these on from the standpoint they can rip. You really don't want them to rip.
You need to tie them in the front with simple bow ties. We do not want to have knots in there, because with knots, then when you break them, it can aerosolize whatever's on your boots, which is not advisable. The booties go up to as close to your knees as possible, depending on how tall you are. And Lynn's going to tie up the other one.
For footwear, I recommend that you have something more like Crocs to put on because the plastic makes it easier to get them on and off. So some sort of footwear that's not heavy work boots or anything like that.
Okay, the next thing that Lynn is going to put on is her surgical hood. The surgical hood goes on and it crisscrosses in the front to try to cover as much of your neck as possible. As the observer, I'm going to come over and make sure that all of her hair is in, and I can bring this around and tie this as well. You don't want to choke your buddy. And I'm going to make a simple bow tie as well. And then I'm going to check the front to make sure hair is covered and hair is covered nicely. Okay, what we're going to put on next is our gown. And your gown, when you take it out, would be in a package. We're just using this for training purposes. As the observer, I'm going to assist my donor getting into the gown. I'm going to Velcro at the top. And there is an inner tie, which we are not tying. You bring around the outward tie to the front and have the donor tie it into a simple bow tie. You want it so where you can see it, so you can easily look down when it's time to get undressed and just pull the string with your left hand.
Yeah, so long ties are preferable if you have a longer tie strap.
Okay, the next thing that we're going to do is we're going to put on our mask with face shield. And this too sometimes is a little difficult, so as the observer, I can take and tie this up, and Lynn will communicate to me if I'm getting it too tight or if that's good.
A little tight.
Too tight?
Yeah, there. Good.
Okay. And you want to try and make the loops as small as possible, because when you're taking it off, you want to be able to reach your pull tabs. How's that?
Good.
Okay, so we've got our surgical mask with face shield. Our next item that's going to go on is a face shield. And this sometimes can be a little tricky to put on by yourself, so the observer has to help. I usually give it to my donor, and then I kind of go in the back and help them get this. And you have to adjust the foam sometimes. You want it, the plastic from the surgical mask, you want above the foam, so everything is sealed there. And it comes down nicely over her face. Okay, now it's time to put on the first pair of gloves. I'm going to hand Lynn the regular nitrile gloves. They go on, and the cuffs of the gown go over top of the gloves. And this is the person that's donning can pretty much do this part themselves. They do need assistance with the second pair of gloves.
And then the longer pair?
The second pair of gloves is the extended cuff nitrile gloves. They are purple, and they go up to about mid-forearm on the person. And this is where it gets a little difficult, so the observer can take, and you really want to make sure the cuff is tucked down in. And then, so it's nice and smooth there. And she'll put on her second one, and then we're going to duct tape.
You can probably get the duct tape ready.
I'll fix that. What can happen is this, the gown, when they get put on, it can kind of be bunched up. You want to smooth that out before you put the tape on so you can have a nice seal. And then you want to visually check to make sure that you've got it nice and covered. And then at the end of your tape, you want to fold it back on itself to make a little tab to make it easier to take off. And you want to make sure that white part is covered there, so you want to make sure they're pulled up nice. You don't want to make it too tight to cut off circulation, but you want it nice and secure. Okay, now Lynn is ready to go, and if you notice, she's standing there with her hands up in the air. This is the best position for you to be when you're not actually doing something. It keeps your hands from being contaminated by your gown, and it keeps your gown from being contaminated by your gloves. The other method you can do is stand with your hands clasped together. Either one is fine. At this point, I would have Lynn do a spin around, and I would make sure that she is entirely covered. And I didn't mention, but when you do put the gown on, you want to pick a size larger than you normally wear. Not so much for it to go around you, but for the length. You want it down so your entire lower body is covered. And Lynn's ready to go in. So Lynn's going to go into the exam room, and the door would have been shut. And we're going to shut the door. Now, all communication with my person that has donned has to be done through a door, and the door does not have a window. So it's extremely important that you have good communication between yourself and your donor, and just by either knocking and saying, "Are you okay, Lynn?"
Yes, I am.
And she would respond back. Lynn, the person that has donned, has to be in sort of the driver's seat. They have to communicate to me when they need to do something such as put on a third pair of gloves and then removing those gloves, because they have to do a 4-minute wipe after they remove the third pair of gloves. They don't have a clock in there. I am going to be their eyes and their clock. So she would tell me when she's beginning her bleach process. I would time it, and then I would let her know when she's finished. So there has to, like I said, has to be communication. It's extremely important because I can't see her. Lynn, do you need anything?
Gail, we're all set. I got the vital signs.
Okay, just let me know what they are.
Okay, blood pressure is 132/84.
Okay.
Heart rate, 83.
Okay, I've got the vital signs. Are you ready? Are you done and ready to come out?
Gail, my patient has vomited. I will need to clean things up.
All right, I just want to remind you you need to put on your third pair of gloves, the plain regular nitrile gloves. There should be some right in your room.
I got them.
Okay, very good. Let me know once you're done cleaning it up, and then we'll go through the process of getting out of the gloves.
Okay, I'll let you know when I'm done.
Okay, it's important to, anytime that the patient vomits or you're dealing with urine or feces, that you must put on a third pair of gloves in the room. They are also removed in the room.
Gail, I'm all done cleaning up.
Okay, very good. Lynn, what I need to have you do is remove the gloves using the glove-in technique and discard them.
Okay.
The third pair, I mean. And once you've completed that, I would like to have you start the bleach process. Please let me know when you're starting, and then I can time you. It's a 4-minute bleach wipe.
Okay, Gail, I got my bleach wipe. I'm going to start bleaching my hands now.
Okay, I'm timing. Okay. Once the 4 minutes is up, Lynn's going to discard the bleach wipe in the garbage, and then she would be free to do any other duties in the room that she needs to. So, Lynn, your 4 minutes are up.
Okay.
Do you have other stuff you need to do for the patient?
Yeah, I got 2 other things, and then I'll let you know when I'm done.
All righty. Are you done and ready to come out?
Yes, I am.
Okay. I'm going to have you begin the bleach wipe protocol. If you can go ahead and take the bleach wipe and start to wipe your hands, and I will time you for 4 minutes.
I'm starting to wipe my hands now.
Very good. What Lynn is doing right now is the 4-minute bleach wipe. It has to be a 4-minute wet time. If she is wiping her hands and the wipe gets dry, please just use another one. In addition to the wiping of her hands, it's very good idea to wipe down the door handle that you're going to be touching to come out of the room. While Lynn is doing her 4-minute exit bleach, I'm going to be on the outside of the exam room setting up the doffing area. What you need to set up is the doffing pad. You need to have your chair set right beside this, not on the doffing pad, and your red bag double garbage right on the other side here. Okay, so Lynn's 4 minutes are up, so I'm going to go ahead and tell her to come out. Okay, Lynn, you may come on out, and please step onto the doffing pad. Okay, Lynn, you feeling okay?
Yes.
All right. The first thing that we're going to have you do is remove the duct tape from around your gloves and discard. Now you're going to remove your purple nitrile gloves using the glove-in technique. Okay, Lynn, the next thing we're going to do is take off your gown, reaching to the back, top, remove or loosen the Velcro. And with your left hand, reach down and untie your tie. Make sure it's nice and loose. And then turn it inside on itself. Wadding it inside out. And that goes into the garbage. Lynn, if you noticed, did a very nice job keeping it away from her body. Next, we are going to have you sit down in the chair and you're going to remove your disposable boots. Please untie the bow ties without knotting them. And then you're going to carefully remove them by rolling them inside out on itself, down over your shoes. You want to make sure you don't touch your pants and or your shoes if at all possible. And that goes right into the garbage. And then do the same with the other boot. Okay, Lynn, you can step onto a clean part of the doffing pad. Okay, now we're going to be removing your inner gloves using the glove-in technique and discarding. And I'm going to squirt some sanitizer in your hand, and I'm going to have you do hand sanitizing. That needs to be done without touching the person that is donning, or doffing, I mean. And then once your hands are dry, I'm going to drop in gloves. Again, no touching, just drop them into their hands. And they are a little difficult to get on when you've just sanitized your hands.
So a little bit larger size than normal is probably good.
Okay, what we're going to do now is we are going to remove the outer face shield. You're going to reach up and grab the big strap, you got it, Lynn, and pull it off over your head and put it right into the garbage. Okay, now we are going to change the gloves again and perform hand sanitizing. And I'm going to, once she's done, give her a clean pair of gloves. Okay, now Lynn, we're going to take off your face mask with shield. Reaching up, you want to untie the lower tie first, and you've got the tab. Go ahead and pull. Yep, you're good. This is where you really do have to try and communicate with the person that's removing it because it's very hard to feel. Yep, you've got the tab. Perfect. Go ahead and throw right into the garbage. Okay, now we're going to remove the headgear. You're going to untie. It's a simple bow tie. You can just pull right there. And loosen, uncrisscross, and then reach towards the back of your head and remove it and throw in the garbage. Now at this point, your hair could be a little out of sorts. You do resist the temptation to reach up and get it out of your face. You do not want to touch anything at this point. Now what we're going to do is have you step off the doffing pad and go ahead and roll it up upon itself, making sure not to be flitting it in the air. That gets placed right into the garbage. And now you're going to remove your pair of gloves using the glove-in technique. And the last thing that we'll do is some more hand sanitizing. And you are now ready to resume your duties.
Thank you.
Okay, a special note for housekeeping. When you're in your enhanced PPE, you're going to be coming here to the ESD area and cleaning the doorways and the CSR areas. Once you're done cleaning that, you and your observer, with you keeping your hands up in the air, are going to have to actually walk through over to the fast track area, and that's where your doffing pad will be set up for you to doff. You're going to go right into room 2 that would be set up for the doffing area for you. Let's recap. For your safety and everyone else's safety, we want to make sure to stress that you do not rush. Take your time. It's important to have good communication. You need to have eye-to-eye contact with your observer. If they're looking at their clipboard, reading off what you need to do next, you need to wait and make sure that they are looking at you when you are doing whatever they are saying you do, before you do whatever they say that you need to do. And you just really need to listen, and again, we can't stress enough the good communication. Thank you.